Hi, Lewis. My name's Autumn. I'll be your hygienist. How's it going?
Pretty good. I'm doing all right.
What brought you here today?
Well, I have felt my teeth a little bit loose lately, and I told my wife about it, and she was kind of concerned, so she told me I needed to come in.
Okay, awesome. Have you ever heard about gum disease before?
I've heard of the term, but I don't really know what it entails.
Okay. Has anyone ever told you you have gum disease?
If they have, I didn't remember.
Okay, that's totally okay. I'm just going to go over a little bit about gum disease and decide how it progresses. I'm just going to show you how it progresses.
Okay.
So first I'll show you what healthy looks like. So healthy is these fibers, you see them?
Yep.
They're connected to the root of your tooth and the bone. So all of these are intact, and then the bone levels are adequate. We have them right up against this line, which is just where your root meets the top of your tooth. So we use this little tool, it's called a probe, and it has little measurements on it. I have one here for you to see. So at all of these lines is 3 millimeters. So that's just how we measure your pocket depth. And your pocket is the space between your gums, your tissues, and your tooth.
Okay.
So this would be considered healthy, 1 to 3 millimeters.
Probably not what most of my teeth are.
Right, okay. I'm glad you know. We're going to get into that soon. Okay, so this is gingivitis, the first step of the disease. So this is just, we have a little bit of infection. This is caused by bacteria that sits on the tooth and creates a biofilm, which then creates what we call plaque. When plaque accumulates, it can create inflammation. Signs of inflammation can be redness or swelling, which you can see here, the swelling. In gingivitis, there's no loss of fibers and no loss of bone. We just have that redness and swelling, which creates a larger pocket depth.
Okay.
So, moving on, when the disease progresses a little more, we can get into periodontitis. So, periodontitis is we have loss of those fibers and loss of bone. We also have a little more buildup of tartar. So, as you can see, this probe reading is little under 6. So that is considered unhealthy. We don't want that. So as the disease progresses further, we get to moderate periodontitis. So this is just we're losing more bone, we're losing more fibers, and we have more buildup of tartar. So what creates this is the body's immune response. So the body doesn't want all that bacteria sitting on your tooth, and so it's trying to basically get rid of your tooth.
Oh.
So that's why we're losing bone and we're losing those fibers, because the body doesn't want all that. So as you can see, it's way more red and you have a lot more buildup. So moving on, we have advanced periodontitis. So this is what I believe you have. Another term that we use is severe chronic periodontitis.
Okay.
So this is just more loss of bone, more progression of the disease, more loss of fibers, and more buildup. And as you can see, we're losing some of that tissue. So the tissue is below that surface of your tooth. We're just losing more and more.
Okay.
All right. Do you have any questions so far?
No, I don't think so.
No? Okay. So, do you want to keep your teeth? Do you have motivation to keep your teeth?
Yep, I'd like to keep my teeth. I know I've lost a couple, and that hasn't been fun. It hasn't really affected me too much, but I'd like to keep my teeth in a knot.
Awesome. Good to hear. Okay. So, next we're going to just talk about some risk factors. These are local and systemic, local being in your mouth, factors that can increase your risk for periodontitis. So right now you're at a high risk because of smoking. I see that you're taking smoking cessation aids to stop that, which is awesome. Do you feel like you can keep doing that?
Yeah, it's been going well so far. My wife's kind of been helping me out, so we're getting there.
Awesome. Okay, good to hear. That will really decrease your risk for periodontitis and really help build those tissues back up. Systemic, which is body-wide, this is a risk factor. I noticed you had prehypertension, so we just want to control that and get that, make sure it's maintained so it doesn't become a big risk factor for you specifically. So with that being said, I just want to talk about the treatment plan that I've made for you. So first we would be doing non-surgical periodontal therapy. This is where we just take our specialized instruments and we clean your teeth. So we just get in your pockets, that space between your tissues and your root surface, and we clean all of that tartar out the best we can. We use water irrigation instruments, hand instruments, and then with our mirror, we also can use adjuncts along with that. So for the 4 appointments I have for you, the first one will be an OHI appointment. This will be just talking about oral health instruction. That's what OHI stands for.
Mm-hmm.
So we'll just be talking about how you can maintain your oral health, how you can be keeping your toothbrushing up, your smoking cessation aids, your flossing, inner dental care, stuff like that.
So it's kind of just like a little more education for me
Right.
to help get my teeth a little more healthier.
Exactly, just so you're not so overwhelmed during those appointments when we're actually cleaning your teeth.
Okay.
So the second appointment, we'll have you come back and we'll be doing the non-surgical periodontal therapy. So this would be on your right side of your mouth, your top and bottom quadrants. So we'll just be cleaning those. And if needed, we can use a local anesthetic, a topical anesthetic, or nitrous oxide. This would just help be more comfortable for you. So we can use that if needed. So we'll do that on one appointment, which will take 4 hours.
Do you guys choose which one, or do I choose which one of those?
We'll choose deciding on some other factors.
Okay.
And then the next appointment, we will do the same thing, just on the other half of the mouth, and that will also take 4 hours.
Wow, that's a lot of work.
Yes. So we're glad you're here. You can be with us even longer. The last appointment will just be a tissue check appointment. This will be 4 to 6 weeks after. We'll give your gums some time to heal so they're not so irritated by what we've done.
Okay. How long between the second and third appointment do I have to wait? Is it just?
We'll probably just wait about 2 weeks.
Okay.
So along with the local anesthetic, after we clean your teeth, we like to use Arrestin. Arrestin is an antibiotic therapy that it just comes in a little capsule and we can place it. It looks like a syringe, not a needle. We'll place it in those pockets, those deeper pockets, 5 millimeters and above. And this will just help maintain and help regrow those tissues and make sure that the bacteria doesn't come back.
Okay.
So that we want to use on 10 of your teeth. That's what I have decided, and we use them on different surfaces of the teeth, but ultimately we'll just be using it on 10 teeth.
Is it primarily for like the worst 10 teeth?
Yes, the ones that are 5 millimeters and above with those probe readings.
Okay, gotcha.
Yeah. So after that, we will do your reevaluation appointment. This will be discussing whether you need a referral to a dentist to get a new tooth in where that one is missing, or maybe a periodontitis if we feel that your bone levels aren't adequate to keep up with supporting your teeth.
Okay.
So the prognosis, which is just how likely it is for you to have a good outcome of this,